Good morning, everyone. I am Dr. Tejas Sheth. Today, I will going to talk about how can surgical simulator be an effective tool to teach importance of a good grip of holding instruments. I myself am a senior instructor associated with the Help Me See. Help Me See is an international organization offering simulation-based training for cataract surgeries. They have simulators which are high fidelity virtual reality based simulators which are mainly built to support the training for cataract surgeries, and further developments are also on. They have a inbuilt feature to give real-time feedback to the trainees about their performance, and also has a feature to compute each task as a satisfactory or a unsatisfactory based on some specific program parameters. So we actually involved 20 trainees for 4 days SICS course at Help Me See Mumbai Training Center of Excellence. They were demonstrated the task and they were told to repeat the same tasks. The tasks assessed mainly were the tunnel dissection and capsular access. The trainees were divided into two groups based on whether the trainee had a good grip or a faulty grip. The faulty grip was mainly the grip which was either very tight or where the distal interphalangeal joints were kept in hyperextension position. These were basically divided subjectively. The number of attempts each trainee required to get the first satisfactory attempt was observed and compared. And the number of attempts each trainee required to get the 6 satisfactory attempts in the last 10 attempts were observed and compared. Out of 20 trainees, 13 trainees were found with faulty grip and 7 trainees had a good hold on their instruments. So you can see on the left side, when we see the central tunnel dissection with a good grip, the surgeon, the trainee easily goes and does a tunnel dissection. If you see on the left side, the surgeon is holding the index finger with the distal interphalangeal joint in a hyperextension position, which tends to depress the heel of the crescent and ends up into a buttonhole. At the same time, when you compare the lateral tunnel dissection, a trainee with a good grip can easily swipe the crescent and get a good lateral tunnel dissection. And on the right side, if you see trainee has a very tight grip, he is able to move the whole wrist and not the fingers. So the whole crescent gets curved and he gets a premature entry. Similarly, when we see the capsular axis, the trainee with a good grip ends up dragging the capsule without any particular complication. And a trainee with the tight grip ends to press on the nucleus while dragging the capsule, which causes a zonular damage. Now here we can see the table clearly says that number of attempts required for the trainees with the faulty grip was almost more than double the number of attempts required trainees with the good grip. And this was statistically significant for both the task tunnel dissection as well as capsular axis for getting the first attempt as well as getting the 6 satisfactory attempts in the last 10 attempts. Our study signifies the good importance of the good grip and faulty grip during the simulated cataract surgery. This aligns with the observation made by Burgess et al. They also noted that different hand positions can influence different surgical outcomes. The observed higher number of attempts needed by the trainees with the faulty grips in our study corresponds with the Burgess et al. Discussion on addressing the M6 learning curve. In conclusion, we believe that our study demonstrates the impact of grip variations on the surgical performance, emphasizing the role of Help Me See surgical simulator and objectively assessing these nuances. Having a good grip on instrument allows the trainee to have a better control over the movements. Identifying and correcting the grip in the early days of learning curve is very important, which can help them in learning other ophthalmic surgeries as well. Thank you.
That is a good paper, but what extra information are we getting in this study?
The extra information is basically what happens many times when we are into training. Many times we tend to neglect the grip of the student. So this helps in two ways. One is to tell the instructor that you need to focus on the grip of the student. At the same time, the trainee who comes in and sits in the simulator, he understands that if he is going to continue with the faulty grip, it will be taking lots of time for him to understand the small movements and have a good control over the movements.
This is a well-known fact that the grip should be loose. It's already a proven fact. So is there any extra add-on information that we are getting?
The simulators will help the trainee to change the grip and learn it on the simulator rather than doing the same thing on the live patient.
I think there is documentation. So they have shown the documentation, which is an extra thing probably.
Suppose in the wet lab we compare the simulator and the wet lab. Is there any difference in your opinion?
The first thing, the simulation will not give a real life feedback. Let's say we are doing on the goat's eye. If there is some zonal damage, we might not be able to understand, maybe around 10%. We will be able to understand only maybe when it is more than 25%. So we will be able to understand even before the complication, the major complication occurs.
Thank you very much.